Dr. Scott Jutte here in Dixon, Tennessee, and today I wanted to go over the chiropractic mindset. And I had to laugh to prepare for this because I had to actually pull out the calculator to see how many years ago it had been. And 28 years ago, graduated from the mecca of chiropractic philosophy called National College of Chiropractic. And I'm sure things have changed since that time, and um, chiropractic is stronger than ever in the college level, but unfortunately, I don't see that being the truth with the young doctors that I talk to. And to get the chiropractic mindset, it's like going to the gym and exercising. It's going to take time. You're not going to come out of school very rarely with a chiropractic mindset. Now, some do, but again, for most of us, we have to get around mentors that have been there, done that. For me, my mentors had graduated from chiropractic school in 1955, 56. So, these guys they had been there, done that. Several of them had been in jail for practicing chiropractic, and they were just a wealth of information and knowledge to talk to. And that's really where I cut my teeth on the chiropractic philosophy. And, what have they always would say, what do you got to lose? If they've been everywhere else, what do you have? You can offer them some hope and give it a try. And honestly, the doc would say, listen, he goes, 80% of the patients that came to my office were told to go home and die by their medical doctor. And yet they come to me for, some kind of an answer or hope. And he says, the amazing thing was, as I jumped in there and I started taking care of these people from a natural perspective, with the adjustment, with nutrition, et cetera, a vast majority of these people are still alive today. And he said, had I not tried, or had I been, referred out, which is how I was trained, I think we learn more about how to refer a patient out than actually work on taking care of them. He says, what do you got to lose? If they've been everywhere, you got nothing to lose. But apply some common sense. If there's a limitation of matter, if it's at that point, be honest with that person. Tell them where they are. If they haven't been anywhere else, again, common sense applies. Be the doctor. And if it's something that's in a crisis or that needs medical attention, get it out. This whole philosophy of that drugs and surgery are evil is bull. All right. The fact is, drugs and surgery can save your life in a crisis. However, we just understand from a natural chiropractic understanding is that drugs and surgery are for crisis situations. And 80% of the time, the public is going to those services and it's not a crisis. And we see what the side effects of that are. It's devastating. So, use some common sense. If things aren't changing, get a second opinion. I've never hesitated to refer out, but honestly, it shocks you when you get in there and say, you know what, let's give this a try. Let's try it for a month. Let's try it for 2 weeks. And the vast majority of those people start to see improvement. And the funny thing that'll happen at that time, you're kind of iffy about, gosh, maybe I should get out and get a test. And the patient's in there like, doc, I'm doing great. Hang in there. I'm fine. And it's funny. I've had patients talk me off the ledge. And so it just reaffirms your chiropractic mindset. And it is a mindset, but it does take practice. It takes effort. It's going to be like any other muscle in your body. You've got to practice it. You have to study, continue to study, and just do what's right for people. That's all they really want. They're not expecting miracles from you a lot of times, but the joy of chiropractic is oftentimes you deliver the goods, you deliver the miracle that they've been looking for, and they get help where no other help has been given to them. And that has always been the stronghold of chiropractic. We get results when everyone else fails, and that is a very, very powerful thing to offer someone. But you know what? You'll never see that if you don't give it a try. So I hope that helps, and I hope everyone has a great day.